Hey, good morning, good afternoon, good evening. My name is Dr. Abdikadri Islamiat Oluwatoyin, Dr. Mia. It's a beautiful Saturday morning over here, and yeah, it's raining, so everyone wants to sleep. But just take a little minute, or a few moments, and watch this video. Trust me, it's gonna be so beneficial. And what am I talking about today? I'm talking about diabetes. My last video was also about diabetes because I advised people to know their diabetic status, to know if they're diabetic, pre-diabetic, or not diabetic. So today I'll be discussing further on diabetes. Now, have you known your diabetic status? If not, you still need to go to the hospital to know your diabetic status. Sit down there, watch this video, and you would know the main reason why you need to know your diabetic status. Have you discovered that a fasting blood sugar of more than 7 millimole or 120 millimole simply means you're diabetic? Have you known that? Or a random blood sugar of more than 11 millimole or 200 milligrams simply means you're also diabetic? Have you known that? You need to know this. But listen to this video, watch this video, share with anyone, like, put down your comment and you share. In fact, if you're not diabetic, you can tell your parents, your neighbors, or anyone around you, educate them about diabetes, because it's some things we need to know. It's a major disease that is occurring in Africa that we need to know about. Now, what will I be talking about today? I'll be talking about the signs and symptoms, the complications, the treatment, and some other things you need to know about diabetes. What are the signs and symptoms? What are the things you see, or what are the things you suspect, or when you say them or when you do them, you suspect that you have diabetes? For instance, you could realize that you're losing weight. Yes, you're losing weight despite that you have a good appetite. You're eating a lot and yet you're losing weight. This could be a sign of diabetes. Also, you're drinking a lot of water. Like, you're always thirsty, thirsty, and you drink a lot of water. Or you go to the toilet a lot. Yeah, that is, you urinate a lot. When you urinate a lot and you drink a lot of water and you're losing weight, you could suspect that you're having diabetes. And the best thing to do is to go to the hospital and you do your blood sample to know if you're diabetic. And also, when you urinate a lot, normally at the initial stage of urination, the urine is always frothy, like there's a foamy urine at the initial stage. But when you realize that, oh, you've even finished urinating and your urine is still foamy, it's still foamy, then that is another sign that you are diabetic. And also, some people actually say when you urinate and ant comes on the urine. Yes, it could be a sign, but not all urine that ants do not get on means that you're not diabetic. No, it's not a major diagnosis, or it's not a major symptom. But just, you need to know that when you're drinking a lot of water, when you're going to the toilet a lot, then you're diabetic. And another thing is, for old men, they realize that they have erectile dysfunction. Erectile dysfunction in the sense that they don't have erection like they used to have, or in fact, some people could have low sperm count. When you realize that you're having decreased sexual urge like you used to have before, then maybe you're diabetic. Then you need to see a doctor. Then another sign and symptom is that you could have decrease in your visual acuity. For instance, you see very well, but all of a sudden your visual acuity decreases. You can't see something so far, or maybe you see things appearing double, like two, diplopia. Yoruba also call it maybe something onwo by. That's Yoruba people call it like that. Then you need to go to the hospital to know if you're diabetic. Another thing is maybe there's decreased loss of sensation at the lower part of your body, your limbs, that's your legs. For instance, you could step on a pin without you knowing you're stepping on a pin. It's a sign of diabetes. You could come in contact with an hot pot and you don't even know that this thing is hot. Then that is a sign of diabetes. Also, what Yoruba people call paja. When you have paja continuously, then you want to suspect you are diabetic. And again, when you have a feeling, a tingling sensation that maybe worms are working on your body, and whereas no worms is on your body, but you always feel like, oh, something is working on my back, something is working on my leg, then you want to be so curious to know if you're diabetic or not. And there's another thing that is called the gloves and the socks syndrome. Like, you always feel like you're wearing gloves, like your hand, you're wearing gloves. Why on your leg too you're wearing socks, and whereas you're wearing nothing? So you want to be suspicious that you have diabetic. These are the signs and symptoms. There are even a lot signs and symptoms that you can have if you have diabetes, but those are the common ones that when you see, you need to go to the hospital to know, or if your neighbor tells you about it, you need to pay much attention about it. Now, another thing is there's something we call diabetic foot. Diabetic foot in the sense that people that have loss of sensation on their lower limbs, that is on their legs, and they come in contact with hot object or something that could cause an ulcer, that is they have an ulcer or injury on their leg, they tend to have a low mechanism of healing of wounds. Like the healing of wounds in the body is so low. Diabetic people do not heal wounds faster. So another thing is you can just realize that, oh, this wound has been on my hand or on my leg for so long and yet it's not going. It could be a sign of diabetes. So what happens in diabetic foot is that this ulcer or this wound continues to get bigger and bigger and bigger, that it doesn't heal. Then my people would then tell you that what are funny, oh, the stepmother did this to her, or the stepmother did that to. No, you just, maybe it's diabetes, maybe it's just diabetes. Not everything is diabolical in this world. So you need to pay attention to that. And one of the complications is diabetic foot, to the extent that if it's not treated at the early stage, you could lose your leg and you become amputated. Another thing is you could lose your vision. You could become blind because of diabetes. A lot of people wake up one day, they could say yes today, but today they are blind. Why? It's diabetes. Another thing is they could have renal failure. That is, the kidney would stop functioning and all you need is dialysis or renal transplant. And one thing about diabetes is it's either it kills you directly or indirectly. And the worst stage of diabetes is so difficult to treat. The complications are so difficult to treat. So what you need to do is treat the diabetes itself before it leads to all this complication or all this worse situation. Now, what are the treatment, like the treatment to your diabetes? Now, when you go to the hospital, your doctor knows the level of sugar, blood sugar in your body, and the severity of your diabetes could tell us what drugs you would need. Some people use oral medication like oral hypoglycemic agents, while some people use injection, that is the insulin. So it depends on the severity of your disease. Some people that are so observant and they got the diabetes at the early stage might not need injection. They might just need oral hypoglycemic tablets, and they use it maybe 1 hour after food, once in a day or twice in a day. It depends on how the doctor administers the drug. Why some people at the severe stage, they need injection, they need insulin injection, maybe one in the morning or one at night. And another thing is you need to use your drug regularly. You don't want to be negligent, as in you don't want to forget one dose, because if you forget one dose, the damages this diabetes is causing in your body is like in manifold, is like times 10 rather. So you want to be so observant and you want to use your drug so well, so regularly. And another thing is people believe that no, I don't want to use insulin. No, the moment I start using insulin, disease in here, I will die if I start using it. Those are just the fake beliefs people spread around, and you need to elevate that belief from your head. You need to elevate it from your head, because insulin is not what kills. Diabetes is what kills. Because you didn't treat your diabetes very well, then it's going to kill you. Insulin does not kill. Maybe people, they don't know how to administer the insulin. Well, when you get to your doctor, and if your doctor has realized that you need to use insulin, they'll educate you more about using insulin. And if you want Dr. Mia to educate you more about using insulin, or about using or administering any of your drugs, or the complications of your drugs, or anything you want me to educate you about medically, you can drop your comments or inbox me, or on Instagram, I'm Dr. Mia on Instagram, you can inbox me. On Facebook, you can inbox me. You can subscribe to my YouTube channel and send me an email. And yeah, you can just contact me. Trust me, I'm going to be at your service. And hopefully this video is being of great benefit to you. It's no doubt. And you really, like I said earlier, you really need to know your diabetic status. And thank you so much. Have a nice weekend and have a sweet weekend. Thank you.